Usha, again, the question is, again, see, we may be thinking that public health settings is a huge challenge, but I know, and you know also, that even within the private settings, we have huge challenges. So your experience with the challenges both in public private settings, within the private settings itself, because I'm very sure you'd have got n number of referrals which you would have thought that why haven't they tested before, why did they not send it to me before, and things like that. Are these kind of situations still prevalent, and do these questions still haunt you, because you are one of the leaders for women and NCDs in the entire country, who has gone really out of the way to sensitize not only our community of doctors, but also the girls and women, and reaching the last mile with your Divas and the Didi program, and some very wonderful initiatives with many other stakeholders, which is again a rarity in itself, because we have to break the silos and handhold with everybody to propagate the serious intent of what we have embarked on. So, Usha, all yours.
Thank you, Hema. And coming from you, that is really high praise. Thank you so much, because you are, what can I say, the beacon of all of these things. Thank you so much. I think I sent you an email yesterday. I don't know if you got a chance to see it, because this frustration, what you talked about, that how is this happening in 2022? I sent you an email with the blood test results of a patient who had emailed me yesterday saying that I underwent this test. She's my, and what should I do? And guess what test that has been done? And this is a well-known OBGYN and a very good one too. So somebody in her team, has, obviously is doing. They have done 100-gram, 3-hour test. But when they're interpreting it, part of it as IAD-PSG, part of it as DIPSI, looking at the 2-hour value as 140, the fasting as 92, and a 3 hours, 100-gram test. So the most important thing I feel is we all need to come to the same page. And only then, whether we will know the true, let's say, incidence of a condition, we will have what we call message discipline. The message that goes out, there will be a discipline in that in terms of what we are going to tell our patient, because this is so confusing. So I think, is it going to be through CMEs? Is it going to be through, some other initiative, but it needs to happen, or through FOXY or DIPSI, the organizations, associations need to really take this in a war footing, because not only in just screening, it's also in, of course, in diagnosis. And then comes the actual, whether it's medical nutrition therapy or prescribing recommended weight gain, or talking about what medications to use, when do you start metformin, when you don't use it, how many weeks, and all of those things. Everything is all over the place.
Yes.
So this all over the place needs to come to one place. And that, I think, is the big challenge. And to just follow the thread of the earlier discussions, and I sent you that also this week, if we have some mantra like test all,
test
early,
all,
test again, test correctly, and test again in the 4th trimester or postpartum. If we keep, putting this, testing guidelines into everyone, whether it's private or public, I think it will go a long way. But more importantly, we can't do this mishmash of taking DIPSI, IAD, PSG, old WHO, new WHO, Carpenter, Kustan, or even going backwards, taking all of that and putting it in a pot and stirring it. That's not good.
You know what? Actually, the DIPSI test has been so comfortable to the minds of the obstetricians because we said, okay, this is simple to do. One test, one value to
No,
remember. Just let's get
no,
on
no,
with
these
it.
are obstetricians, Emma.
Yeah, yeah. No,
These
but
are,
that has been our comfort level with which
I
we have
know.
been able to convince thousands of obstetricians across the country. Of course, we've not reached all the 40,000, but whomever we have reached are, quite,
Very comfortable. And I
yes,
think that's what we should do. And if it
yes.
is the national guideline, then
Mhm.
obviously then we should all toe the line and stick with that. And then we'll be able to get uniform data.
Yeah. And Usha, but like how the follow-up question is a message, your message to the families who have these girls and women within the family who need to be
Okay,
counseled
so
about their lifestyle.
this
Yeah.
this is not your grandmother's pregnancy. This is not your mother's pregnancy. This is a very different. The health of girls today is different. They are starting out, the landscape is different. They're starting out with the different kind of handicaps is one thing. And the health system has improved so much that women are older, they're, possibly better educated, marrying later, and they can have institution care, they have better health care. So it's nothing is the same as before, except the pregnancy itself. So we will definitely, and the women are starting out heavier, less healthier, more stressed. So many complications are there, more pre-diabetes. So they definitely need to be on, follow the doctor's advice and not the old wives' tale.
Thank you. This is a very important message indeed. Now,